Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and this is quite convenient for the study purpose. I hope you will make use of it. Thank you very much. My dear friends, we have been discussing about newborn care. In the newborn care, we have covered two important topics, that is the basic topics. Condition where we need resuscitation and the basics of resuscitation as explained in Ayurveda, especially Acheshta Shishu. So that portion has been superficially dealt. We will deal it in detail in future classes. So the main topic is newborn care. So there are some general principles of newborn care in the labor room as soon as the delivery takes place. So we know that delivery takes place in the labor room. In the Ayurveda consideration, the delivery would have been, that means delivery, the place of delivery will be a Sutikagara according to Ayurveda. But in the present day scenario, it is a labor room. Now, as far as newborn care is concerned, what are the prior preparations that you have to do before the delivery? That is very important. Always we will use a word, anticipation of delivery. Yes, delivery will be going to take place in few hours, but priorly a pediatrician or neonatologist should be ready to receive the baby. In the sense, baby may be delivered normally, baby may not be delivered normally. In both the condition, neonatologist should be ready to face any situation. So what is very important for this is reviewing of the maternal history. The first task that a PG scholar of pediatrics or neonatology consultant he has to do is he has to take a thorough maternal history or study the maternal history, and then he has to anticipate the outcome, and then he has to prepare accordingly. Now if there is a bad obstetric history is there, if in the maternal history there are some untoward incident like antenatal hemorrhages, in the maternal history it is found that it is a high risk pregnancy. In the maternal history it is found that there is passing of the meconium. In the maternal history that is found that the birth weight is very low, or there is twin pregnancies, torch infections, and all the other high risk pregnancy. Then pediatrician should be ready accordingly. Similarly, second thing before the delivery, what the pediatrician should do is checklist. He has to prepare his checklist of instruments and different steps. He should be very clear in mind that what I should do if the baby is delivered normally, and what I should do if the baby is not delivered normally. If the baby is crying, what is my next step? If the baby is not crying, what is my next step? So this particular was SOP or standard operating procedure, and the checklist should be very, very properly prepared. So especially pediatrician should be ready with the instruments. The most common instrument that we require is a mucus sucker. It may be a synthetic mucus sucker, it may be a mechanical mucus sucker. We need some of the warm towels because temperature has to be maintained throughout. Warm towels. We need a warmer, especially the radiant warmer. We need some nasogastric tube for the purpose of clearing the stomach by stomach wash. And then we need a MUBAC, artificial mechanical breathing unit. We need a laryngoscope of different blade size, and we need endotracheal tubes. We need cord cutter and as well as cord clamper, and we need some of the cotton pads, shoulder pad, etc. And we should ensure the presence of one oxygen resource, maybe oxygen cylinder, centralized or maybe cylindrical. And we should have smart, alert and non-panic mind. We should be very alert and we should do the things very fastly, but we should not get panic. This is the main principle. So these are all the prerequisites prior to the delivery. Now here, why I am explaining all these things, Kashyapa beautifully explains one important quote. What he says is, at the time of the delivery, one leg of the mother will be there in the Bhuloka and another leg of the mother will be there in the Yamaloka. So what he wants to say is, anything can happen during the time of the delivery. This is what the modern science also says. Every delivery is an emergency. Every delivery is an emergency. You cannot neglect it. You cannot take it lightly. Although it may be a normal delivery, but you should be prepared accordingly with all the preparations. Now, at the time of the delivery, you should receive the baby on a clean tray with warm clothes covered and keep or hold the tray at the level of the mother and wait for the stoppage of the pulsations, and do not milk the cord. Collect the cord blood for investigation. So, okay, we have been prepared already. Now, at the time of the delivery, what we have to do? We have to receive the baby with a cool and calm mind. Then, baby has to be kept in a tray. Yes. Then it should be covered with the warm clothes. And keep or hold the tray at the level of the mother. You should not hold the tray above the level of the mother. So then what happens is the blood from the baby will again flow back to the placenta. So we want the extra blood coming from the mother to the baby. Therefore, keep the baby below the mother's bed level. And then stop. That means wait till the stoppage of the pulsations. Do not squeeze or milk the cord. Just cut it. Okay? Don't squeeze it. And collect the cord blood. Then collect the cord blood. And then send that cord blood for the investigations. Okay. So what are the investigations, especially VDRL, RH negativity or RH incompatibility, then blood grouping, etc. So this should be done by using the cord blood itself. You have to collect a sample of the cord blood there only, and then the rest of the investigation should be done. Now clamp the cord with a rubber band or a cord clamper which is available. The distance is about 5 cm away from the baby side. Cut and then ligate with the double ligatures. Leave the cord uncovered and watch for the activity, cry, respiratory rate, heart rate of the baby. Assess the Apgar scoring at birth at 2 minutes, at 5 minutes and at 10 minutes. Next step. Then go for the resuscitation if it is required. If it is not required, go for the normal routine care of the baby. In the meantime, one thing that have to be kept in mind, that is thermoregulation. Dry the baby as early as possible with a pre-warmed towel soon after the birth, and wrap it with a cloth, and the forehead and head portion should be covered. You have to ensure this because temperature loss will be maximum from the forehead and head level, the head area. So it has to be dried first and it should be covered with some of the cloths. Immediately after the birth, then clean the oral cavity, oropharynx, nasal cavity. First oropharynx, then nasal cavity by a gauze piece or the mucus sucker. And by this time, the baby will initiate the breathing because the patency of the airway has been maintained properly, and therefore the baby will going to initiate the breathing. And if not it is breathing, go for some mild tactile sensations on the palm area or in the sole area, and even sometime to the back area in the spinal area. So this what we are discussing about the normal baby. By this time, definitely baby will going to cry in 95% of the cases. Now at the time of the delivery, again cover the baby with a pre-warmed cloth and place it with the mother. After cleaning and all, after taking anthropometry, hand over the baby as early as possible to the mother. And we can clean the baby with the thick oil if it is needed, because oil acts as an insulator for the heat, and also it lubricates the skin and easily removes the Vernix caseosa. Only thing that we have to be ensured is we should not vigorously rub the skin in order to remove the Vernix caseosa. So Vernix caseosa completely may not be removed in a single wash. It may take 1 or 2 days, no worry, but don't go for aggressive removal of the Vernix caseosa. Then clean the eyes of the baby from the medial to lateral side by cleaning the cotton swabs soaked with the normal saline. Record the weight of the baby, assess the anthropometry and the gestation age. Find out any identification marks and footprints. Find out any of the identification marks and take the footprints compulsorily, and wrist tag should be tied because there should not be any confusion in the neonates. Neonatal exchange, neonatal missing, so these things are very common. So avoid all such confusion. Take the footprints, keep it in the record, and also tie a wrist tag. Then very important is record the time and date of birth because that is very important for astrological calculation as far as the religious beliefs are concerned. Now what should be done during the delivery? Record the time of passage of the meconium and time of the delivery and mode of delivery, etc. Then prepare a baby record sheet which contain all the details of the birth, what you have done, what is the Apgar scoring, what are the event took place, and what is the management done. Carry out the preliminary examination of the baby, then rule out the life-threatening congenital abnormalities. There may be some gross congenital abnormalities may be there like esophageal fistulas, coronal atresia, etc. So if there is that, then just confirm it. Then administer vitamin K 1 milligram orally or IM. There is slight controversy whether we have to go for vitamin K or not, but in order to prevent the possibility of early hemolytic disorders of the newborn, usually we will go for vitamin K 1 milligram IM. Put the baby on the breast as early as possible to initiate the breathing, very, very important, preferably within 30 minutes. Okay. Now the normal newborn should be kept with the mother because mother herself acts as a natural incubator, and it also gives the time to mother to talk with the baby, and it also helps in easy early breastfeeding and also development of maternal bonding. At the time of the delivery, the baby is placed next to the mother in the ward, and baby should be kept with the mother in the postnatal ward also, and feeding should be started as early as possible. Exclusive breastfeeding should be done, and no prelactial feeds like water, glucose, honey should be offered. So in the next class, we will see what about the clothing, bed, etc. of the baby. Till then, goodbye. Don't forget to subscribe to my channel, and also please give your valuable comments. Thank you very much.